At the moment, most patient outcomes are still coming from what the doctor thinks. So as I mentioned, survival, for example, after cancer treatment is a very commonly used outcome. That information is important. What we've realised is that we need to start collecting a broader set of outcomes, and in particular, outcomes that patient, him or herself, reports. So for example, there's some interesting studies showing survival after prostate cancer treatment doesn't vary very much across different hospitals. But if you ask a patient about how they're functioning, sexual function and urinary incontinence, for example, then those kind of outcomes, which can only be reported by the patient, vary hugely across hospitals. So unless we start asking patients directly themselves how the treatment's gone for them, we'll have very little idea about how well medicine is working or not. In the work the OECD has done, looking at the way different health systems are collecting this information, we can see lots of diverse methods being used. So as well as you've mentioned, the doctor or the nurse asking the patient directly, there are increasingly things like apps and web-based surveys being used. It's great to see that kind of innovation happening, but what's clear is that it's important to embed the collection of these measures in the clinical encounter.